So I'll just remind you that last discussion was on platelets in this blood section, hematology. Okay. Last discussion was on platelets. We discussed about the structure and functions of platelets, with how platelets have a role in stopping bleeding, what changes do platelets undergo for the stoppage of bleeding, that is adhesion, activation and aggregation. So we had mentioned names of factors like von Willebrand factor and others, collagen, laminin, etc. Those are endothelial factors. Breach of the endothelium, after breach of the endothelium, how platelets are undergoing these certain, we may say, changes or modifications. Adhesion, activation and aggregation, these are very important words, and these terminologies what is called adhesion, what is called activation and what is called aggregation is to be known. During activation, platelets release certain factors from their granules, the alpha granules and the dense granules, two types of granules. These were discussed in the last class. We will move on to coagulation of blood. So platelets is the initial stoppage of bleeding, which is called formation of platelet plug, which is actually called primary hemostasis. Hemostasis, very simply speaking, literally, if we use the term literally, stasis, stoppage of bleeding. But today we will see what hemostasis has, that means another meaning to these words. If you say it simply from the English language, literally it means stoppage of bleeding. Stasis, stoppage. Stasis speaks for stoppage. We had also just, these are about the thrombocytosis, thrombocytopenia, variations in platelet count that we had discussed. And we will just move on to, we have to remember the topics. I am repeating again and again, go through the CBME. Just search for CBME 2024 and see what are the points to be covered. This is a professional course. You can't tell during the university exam that this was not this, my teacher missed this topic, so I don't know the answer. These things are very foolish. So we'll try to go according to the CBME, and I repeat, ask students again and again to go through the CBME themselves. And this is not only for physiology, you can inform your faculties, you can inform the HOD if some topic that this is in the CBME, but this has not been covered, but that section has been covered, but this topic has not been covered. So be responsible, otherwise it is for your own good. So hemostasis is the process of forming clots. See, in the walls of damage, this is stoppage of bleeding, forming clots, stoppage of bleeding firstly by platelets, and then the coagulation pathway, which you already have a basic idea about. What is the coagulation pathway? There are 13, till now you know about, at the school level biology you have read about, say 13, there are 13 factors and all these things you know. We'll just go some a little deeper into that, but you see, just go by this definition, and preventing blood loss while maintaining blood with the fluid state within the vascular system. That means hemostasis not only means stoppage of bleeding, another meaning of what's literal meaning, if you say stasis, very commonly we know it's stoppage, but it also refers to some kind of balance. Commonly we know stasis means stoppage, which is absolutely correct. Even if you look it out in the English dictionary, or just nowadays just go to the internet and search it out, stasis also refers to some kind of balance. So hemostasis, not only stoppage of blood, but not prevention of formation of these unwanted clots. This also comes under the purview of hemostasis. That is preventing blood loss. This is stoppage of bleeding, preventing blood loss during an injury from wounds. That is okay, but also hemostasis also covers maintaining the fluidity, normal fluidity of blood within the vascular system. That means, so that blood should not clot within the vascular system itself. There are various factors for it which we will discuss, but this is also covered by hemostasis. So now Till now, whatever you had known is correct, whatever we had known, it is stoppage of bleeding, but it also covers this maintenance of fluidity, that unwanted clots are non-formed. This also comes under the purview of hemostasis. So, hemostasis stages, vasoconstriction, platelet for plug formation, coagulation of blood stages. This covers primary and secondary hemostasis. Primary hemostasis is formation of the first platelet plug, which we had already discussed about the other day. Activation, adhesion, activation, aggregation, formation of the platelet plug, primary stoppage of bleeding, but without the coagulation pathway coming into action, this will not sustain, this won't sustain. So, with the coagulation of blood, this fibrin clot formation, what you know, fibrin monomers to fibrin polymers, this is coagulation of blood, this is secondary hemostasis. And now what we are telling, what comes under the purview of hemostasis? Formation, prevention of unwanted clot as well as maintaining the fluidity, means these clots will have to dissolve. Fibrous tissue will, after this fibrous tissue formation or fibrous, when the clot should dissolve, so that the wound will be repaired or the injury will be repaired, the clot has to dissolve, otherwise it may itself then block the vascular system. So, that fibrino clot dissolves by fibrin polymers, that word is called fibrinolysis. So, that also involves some factors, that part is called tertiary hemostasis. So, that is not stoppage of bleeding, that is rather dissolution of the clot. So, primary is platelet plug, secondary is coagulation, formation of fibration, these fibrin monomers, then fibrin polymers, but tertiary is dissolution of the clot, fibrinolysis. So, primary, secondary and tertiary. So, again hemostasis is whatever, this is eventual growth of fibrous tissue on the blood, this is coagulation of blood, fibrinolysis. See, last step is tertiary hemostasis. But see, the first line, hemostasis means arrest of bleeding, but this fibrinolysis and prevention of unwanted clot, maintaining fluidity of the blood also comes under the purview of hemostasis. There the word stasis will, just remember it as balance. Stasis means stoppage, but it also refers to this balance. So, nothing to write actually, all these are, I am sure you are following some certain textbook, all these are given, but this is just the concept, that don't just go by hemostasis means just the stoppage of bleeding, not up to the formation of clot, but its dissolution as well. Okay. So, if you have a short note, say hemostasis and its types, like that short note type question or explain why type question, then these concepts you will require. Okay, why? So, it is a natural clotting mechanism. Okay. Thrombosis we will discuss. In short. Thrombosis is within the vascular system. If a clot or certain solid mass is formed within the vascular system. Hemostasis, usually we consider it as outside the vascular system injury. So, outside the vascular system, if the blood is now oozing out from the tissue, cells the tissue. So, the extravascular system is getting involved. So, prevent excessive flowing of blood, its purpose, but thrombosis is within the vascular system, which is obviously harmful. It will stop, it will actually compromise the circulation if thrombosis occurs. Virtschow Triad, after a scientist named certain, I think Rudolf Virtschow. I think he was a German. As far as I remember, he was a German. I was wrong. I just maybe wrong. Rudolf Virtschow, probably Germans. So, this person, yes, anything? Okay. Rudolf Virtschow, no, that. So, after this person, Virtschow's triad, what? Stasis, vessel wall injury, hypercoagulability. Vessel wall injury means breach of the endothelium. So, all these breach of the endothelium and hemostasis itself, these are parts of the stoppage of bleeding platelet plug. These what we are calling hemostasis in literally, that stoppage of bleeding, but hypercoagulability will lead to thrombosis. Hypercoagulability or unwanted clotting will lead to thrombosis. This was what this person spoke about. Hypercoagulability, in that sense, here hypercoagulability is the most important word. Thrombosis, formation of in a way unwanted clots within the vascular system, that is due to hypercoagulability. Vessel wall injury, stasis, these are parts of normal stoppage of bleeding, normally how to stop blood. So, until and unless the endothelium is breached, that is the reason that bleeding has to be stopped. So, then stasis, but here hypercoagulability should be the most important word in that way, speaking in that way. Okay, this is again primary versus secondary hemostasis, the formation of fibrin clot, secondary hemostasis, primary versus secondary versus tertiary, what we spoke of just now. Tertiary is activation of this something called plasminogen, we will discuss. Dissolution of the fibrin clot, that is tertiary hemostasis. So, simple. So, coagulation, process of changing of blood from a fluid state to a solid state. Now, this when coagulation is a process required, this is for stoppage of bleeding, that after the sustaining the platelet plug and activate due to the involvement of the clotting factors, that is coagulation. This is required. Again, hypercoagulability is harmful, but coagulation is actually what is required. Prevent blood loss by plugging the injured slide blood, but the vascular system must maintain an integrate balance, which we are talking about. That if unwanted clots are formed, then what will happen? The circulation itself will be compromised, that is the first thing. Then there will be organ damage, means if the circulation is totally compromised to a certain region, that region will, due to stoppage of blood flow, that region will not get nutrients and oxygen. These are simple things. So, that is the, then it will lead to something more grave and sometimes fatal. If it occurs in the certain organs like the heart, the brain, this leads to fatality as well. So, this is the, that is basic, the need to, that is the need to unclot. These factors which are written in green, these are helping in, that means not helping, or these are associated with clotting, the stoppage of bleeding itself. Some of the factors, thromboplastin or tissue factor we will talk, is one of the factors. Factor number 3, you know, I think you know of 13 factors. Factor number 3, von Willebrand factor, which is from the platelets as well as the endothelium. Platelets, which granules contain this VWF? Alpha or dense? What we told, remember that ADP, ATP, serotonin are from dense granules. Rest, whatever you know, not whatever, but just to very, if we are to simplify, serotonin, ATP, ADP, adenosine nucleotides from dense granules, but other things from alpha granules, especially platelets themselves. Alpha granules contains 2 clotting factors, fibrinogen and factor 5. Actually, they are not produced by platelets. They are produced by liver. Most of the clotting factors, almost all the clotting factors are by the liver, but formed by the liver, but platelets store these 2 factors. These are, all factors are important in that way, but platelets store these factors in the alpha granules. This von Willebrand factor is also from the alpha granules. It is released from the endothelium as well and stored in the, also stored in the platelet alpha granules. Dense granules contains adenosine nucleotides and serotonin. Platelet derived growth factor. So, these are the days of MCQs. Just these will help you, like we told when we discussed differential leukocyte count, Leishman staining. What did you say? Eosin stains. If you go by, try to memorize, this is stained by eosin, this is stained by methylene blue, this will become difficult. Just remember, eosin stains 2 things, eosinophils, granules of eosinophils and RBCs. Rest whatever are there are stained by methylene blue, like that. So, ADP, ATP, serotonin from, or adenosine nucleotides, other if there are, so that is from dense granules, that is, but rest are from alpha granules. VWF, the clotting factors, there is something called the platelet derived growth factor function, so immune function of platelet, which I have already mentioned. So, platelet activity factor, inhibitor of plasminogen activator, we will talk about this. All these are pro-coagulant system. These are part of the green ones, part of the pro-coagulant system. And all these just written in the box side by side, factors which promote blood fluidity. We will talk about this, protein C, proteinase, antithrombin, all these are parts of endothelial derived platelet, nitric oxide, prostaglandin. These we will talk about this again in a little detail. So, these are promoting blood fluidity, but those are promoting this clotting or coagulation. That means fluid to solid is those factors, solid to fluid, which help, or solid to fluid or maintaining, not this is not the correct term, solid to fluid, maintaining this fluidity, these factors. So see, these are the factors which in this blue box which will help to maintain the blood in its, we may say, usual state. Usual state means whatever we know of, blood is flowing within the closed system in a fluid state. So these will help in maintaining blood fluidity, fibrinolytic system, that here that we may call solid to fluid. So these factors, protein C, protein S, antithrombin C, endothelial derived antiplatelet substances help to maintain blood in its usual fluid state. I am using the term usual because the concept is blood is actually in a fluid state within the vascular system. Fibrinolytic system, we may call it as it is converting the solid state to the fluid state, clot busters. Those are these plasmin, plasminogen, tissue plasminogen activator. Now, inhibitor of this plasminogen activator again will be a procoagulant factor. That means procoagulant or maintaining that, taking the blood from the fluid to the, again, potentially to the solid state. So this is activation of clotting. We know thrombin, fibrinogen, fibrin, these things you know. That these things you know means these terms you know, fibrinogen to fibrin. This is the final, how the serotonin has a role. Serotonin has a role is vasoconstriction. Usually serotonin is 5-HT is the chemical, this abbreviation for serotonin. So 5-HT, serotonin has a role is vasoconstriction. Initially after the breach of the endothelium, by constricting the vessel, it tries to stop the blood flow. Serotonin has a role there. Okay, so serotonin is secreted or comes from other sources also, but in platelet switch granules, dense granules. Serotonin and adenosine nucleotides from dense granules. Platelet recruitment, contraction, collagen and thromboplastin, collagen tissue, we will talk about this again. Collagen we have already mentioned, like VWF, collagen, laminin, these factors which are from the endothelium, which are leading to platelet adhesion. That means leading to means these factors are as if signaling the platelets that platelets now should adhere, then it will be activated, they will be activated and then aggregated. Activation of clotting thrombin. So this is just a general idea about this, just showing the general idea, the temporary plug, then permanent hemostatic plug, steps involving primary and secondary hemostasis, and following that will be tertiary hemostasis, fibrinolysis. These are the names of the factors given in books. I will just mention that there will be various names, multiple names for the same factors, and they have reasons. As we go on discussing this coagulation pathway, go on discussing means as we will discuss this coagulation pathway, we will also mention that why the names are such, but names have come historically due to different reasons. Okay, so like say for example, Christmas factor. Christmas factor is after the name of the person in whom this factor was established by the physicians or hematologists. So some physician found this factor in a person named Christmas, and there was a, that means there was a this usual practice those days that these especially in this coagulation cascade, the names you get, the names of these individuals you get, these are actually mostly are the names of the patients or the individuals in whom they were discovered first. So an unknown factor first identified in that person, Stuart-Prower, are two separate individuals, and a common thing was missing when the plasma of these persons, so these are just for historical reference, but plasma of these two individuals were mixed. I don't remember the full names, I read it somewhere, but I don't remember the full names right now. Some Mr. Stuart and some Miss Prower. So when these plasma were mixed, still the blood did not clot. So what was the inference? That some common factor is missing in the blood of both these. So that factor was named as factor 10. So till then other factors were discovered. Factor 10, they named it that this is factor 10, and this will be named after those persons, Stuart and Prower. So that's why the name Stuart-Prower, but there are other names also. What I will suggest is knowing most of the names, because most of the names you will have to memorize. Some things We have no option but to memorize. But as these are the days of MCQs, otherwise these are not required. What 1, 2, 3, 4, what they do, fibrinogen, prothrombin, these are enough. But why most of the names are required to be known? This is from absolutely a standard textbook of physiology, a foreign standard textbook of physiology. Why do we require the names? Because in MCQs, if you get one name, you know about that, but you don't know that name, then you will miss the MCQ. Or even short notes or whatever. So, you know about what is fibrin stabilizing factor, you know, but you don't know the name Lucky Lowland, so you may miss it. Usually, questions should not be set in that way. That is my opinion, but always means never. I am nobody that my opinion will always. So, sometimes if you get the name Lucky Lowland factor, so it is referring to factor 13. That's why if in elimination exams especially, we will get some MCQs. These are just for eliminating. 100 students are appearing for an exam, I have to take 5. So, these are basically very stupid questions. So, mentioning Lucky Lowland, actually all the 100 students maybe are expected to know about factor 13 and what it does and how it does. But just they don't know the name, that's why say 10 people miss it out, 20 people miss it out. So, that's why I'll just mention that you should know this name. So, I'll allow you to write it down. Just we continue the discussion for now. I'll just allow you to write it down within the scope of this hemostasis class. Okay. So, this is what is intrinsic pathway, extrinsic pathway, which you already know from the school level. So, if we write it very simply speaking, this is looks like this. So, 12 to, so factors are activated in the intrinsic pathway. 12 to, it starts with factor 12 being converted to activated factor 12, very simply speaking, 12 to 12A. So, whatever is it at 12, then comes 11, then 9 and then 10. Conversion of factor 9 to factor 10 requires factor 8 and activated form of factor 8. That means factor 9A, not conversion of factor 9 to factor 10, this is a wrong statement, this is a wrong statement. 12 activated factor 12A will help in activation of factor 11, then activation of activated factor 11 will help in activation of factor 9 and then activated factor 9 in activation of factor 10. So, activated factor 10 is what we require for the next steps, activated factor 10 for why is it required along with activated factor 5, which is required for the conversion of prothrombin to thrombin, and thrombin will help in the formation of fibrinogen to fibrin monomers, then they will be polymerized. This is what you know from your school level knowledge. So, this is what is showing that simply this is intrinsic pathway, that is the extrinsic pathway. Now, why are these called intrinsic and extrinsic? Usually lecture classes are this one-way conversation. I will just ask you, but at this moment I will ask you intrinsic and extrinsic, why these are named so? Do you know it? What is the if we take the English term intrinsic, what does it mean? Just the concept. Not even if you don't know the intrinsic, what do you understand by the word intrinsic? What is natural? What is naturally present? We call that intrinsic. Within, intrinsic within, or what is naturally present? Extrinsic outside some system, any system, whatever we speak about extrinsic, that means outside that system. Okay. Now, very commonly it may come to the mind that intrinsic means something out inside the body. This is very, just to a layman it may appear, we are talking about human physiology, we are talking about the human body. So, intrinsic means inside the body, extrinsic means outside the body. So, this is a very common mistake, that there is no harm in making mistakes. So, without understanding what it actually means, if we just go by intrinsic means inside the body, extrinsic means outside the body, but that is not the reason. What is intrinsic and what is extrinsic? Here intrinsic refers to blood, intrinsic refer that what is within the vascular system will refer to intrinsic. What is outside the vascular system within the body, of course within the human body, but outside the. So, factor 7, which is the first factor to be activated in the extrinsic system, it is called, it is See the name. Sorry, factor 7 is not the first factor, tissue factor. It is thromboplastin. It is called tissue thromboplastin or tissue factor. Factor 7 is not the first factor. Factor 3 is the first factor. So that is the reason it comes from tissues, extravascular tissues, not blood itself. Other factors are within the blood, but tissue factor comes from tissues, that is extravascular tissues. That's why this extrinsic means this is extrinsic because it is outside the vascular system. That's the significance of the term extrinsic here. What terms do we use for inside the body, outside the body? Latin terms. So these terms, Latin terms are used in vivo. In vivo means within life. Outside the, inside the human body, in vivo, Latin term means within life, within the body. Within life, that means within the body. In vitro, outside the body. So those terms are used for inside the body, outside the body. Commonly it may appear extrinsic means outside the body. No, how can a coagulation pathway occur with some factor outside the body? Outside the body it is not possible. Extrinsic means outside the or from the extravascular tissues. That is the significance of the term extrinsic here. So here also for the final prothrombin conversion to thrombin in the extrinsic pathway also, what we require is factor 10. Then the thrombin will help in the fibrin monomers to convert to firstly the conversion of thrombin to fibrinogen to fibrin, and then the fibrin monomers will get polymerized to form clot formation. So that is the what we call as the common pathway. So factor 10 onwards, activated factor 10 onwards, its common pathway. How the activated factor 10 will come from in the intrinsic pathway through the all the factors within the blood itself, 12, 11, 9, then 10, and in the last step from 9 to 10 it requires activated factor 8 also. Activated factor 8, which is again activated factor 8. Activation of factor 8 again requires what product? A downstream product, thrombin. So this is what is may seem paradoxical, but actually thrombin is not the only source of thrombin, is not this coagulation pathway itself. So thrombin is itself there. So thrombin is a product which will itself convert, not alone, but it is helping in the conversion of activated factor 8 to activated factor 8A, which is required for the formation of activated factor 10. But in the extrinsic pathway it is tissue factor and factor 7, which is ultimately leading to the formation of factor 10, activated factor 10 from factor 10. What is the name again? Factor 10 name is Stuart-Prower Factor. Factor 9 is Christmas factor. Factor 12 is, again we have a look at it, I will allow it to write it down. Factor 12 is Hageman factor, glass contact factor. So intrinsic system, Hageman factor, this factor 12 which we see here, factor 12 outside the body, intrinsic but out. So don't mix it up. Intrinsic outside the body, glass contact factor means this same intrinsic factor can be put into action outside the body if it comes into contact with glass. That is why the name for factor 12 is glass contact factor. If you just can remember why these names are there, that's why these are of historical importance, but it will just help you remember if you just know this info. Maybe you can remember the names of the factors as well, just more conveniently. You have to memorize, we all have to memorize, but just more conveniently it will help us remember why this is called glass factor or even glass contact factor, because outside the body this same intrinsic system can be put, that means it can come into action if it comes to blood comes in contact with some glass surface. So that is called, that is why it is called glass factor. So this is the intrinsic pathway. Again see 12 is just a bit in detail. See activated factor 12, what happens is there is some, all these are proteins of course, kininogen, HMW is high molecular weight. High molecular weight kininogen, what it does? It has a potential to convert factor 12 to factor activate the factor 12. So, high molecular weight kininogen has that potential, but this is very slow, very slowly it occurs. So, what is happening actually, the target is stoppage of bleeding through the formation of this. This is what step, primary or secondary, involving the clotting factors? Formation of platelet plug is primary, and involvement of clotting factors is, this is the part of the secondary, the fibrin clot will be formed. So, that we cannot afford, that means the body cannot afford a very lengthy process, it has to be quick, within minutes. So, this is kininogen converts 12 to 12A, but very slow. Now, what happens? You know about negative feedback and positive feedback. Most feedbacks mechanisms in the body are negative feedbacks, but here most are negative, not positive, most are negative, like in the endocrine system. But here is an example of positive feedback. What it does, as this kininogen leads to formation of some factor, activated factor 12, some of it, this itself with the help of another protein called kallikrein, it converts pre-kallikrein, this factor itself converts the precursor of kallikrein called pre-kallikrein to kallikrein. So, what it does is pre-kallikrein now, when kallikrein is formed, once some kallikrein is formed together with kininogen, it hastens the process of converting factor 12 to factor 12A. So, this is some detail of what occurs, otherwise simply it is 12 to 12A, and 12A means activated factor 12, which will convert factor 11 to 11A. But this is what happens in between. Kininogen converting 12 to 12A is a slow process, but once some amount of 12A is formed, very little amount of 12A is formed, it itself can convert pre-kallikrein to kallikrein, and kallikrein and kininogen together will now hasten the process of forming activated factor 12. Now activated, now as more and more activated factor 12 comes into action, conversion of 11 to 11A is now possible more quickly, and along with calcium ions, which is factor 4. Factor 4 is calcium ions. Along with calcium ions, it will now convert factor 9 to factor 9A. Again we go by the names. So, factor 1 is, factor 1 we will talk about later means just after this. So, 12 is, again 12 is Hageman factor or glass contact factor. Why the name? Outside the body, intrinsic system can be activated in contact with glass. So, glass contact factor. Then 12 to 12A, 11. 11 is what? So, it is anti-hemophilic factor C. We will talk about hemophilia in very short. It is within the scope of your syllabus. They have written it as discuss the some bleeding and clotting disorders. They have exemplified hemophilia and purpura. So, we will talk very little about that, not very detailed, but so there is hemophilia. One type of hemophilia is hemophilia C, which is caused due to the deficiency of factor 11. So, it is anti-hemophilic factor C, also called plasma thromboplastin antecedent, that is some relation to thromboplastin. Everything you know, no need of explanation, but some things just try to memorize, otherwise actually there is no way out of it. So, it is thromboplastin antecedent. Another is 9 is Christmas factor. I told you why it is historical importance, and it is deficiency of it causes hemophilia type B. So, it is anti-hemophilic factor B, and another name is plasma thromboplastin component or PTC. Don't use, these are not very commonly used abbreviations. So, either you use the full name or use the other names, but why should you know all the names? Just for tackling some questions, otherwise if only one name is given or one name is mentioned, you can't understand what it talks about. Usually factor 9 is referred to as the Christmas factor, factor 10 as the Stuart-Prower factor, factor 11 as the anti-hemophilic factor C. Okay. Then factor 8 is deficiency of factor 8 causes hemophilia type A, the most classical hemophilia. So, it is also called anti-hemophilic factor A. but anti-hemophilic type of globulin. Globulins we have talked of as plasma proteins, so it is type of globulin, so it is also called anti-hemophilic globulin. So now the intrinsic and extrinsic pathway and the common pathway, this is what happens in the extrinsic and intrinsic pathway. Extrinsic pathway again tissue to tissue factor, factor 7 to 7A, activated factor 10 will convert to 10A, and this requires calcium. Calcium and thrombin are two things, the two of the things which are required in various paths. Mainly calcium is involved in various paths in the, not paths, path is same, extrinsic, for various steps of the both the pathways. Calcium is required at various steps of both the pathways, right. So, calcium, which step here? See, 9 to 9A requires calcium, again 10 to 10A requires calcium, and also 10 to 10A also requires activated factor 8 and activated factor 9. Who will convert activated factor 8 to 8A? This is thrombin. Now, this question may appear in the mind, thrombin has already, it is already yet to form in the coagulation cascade, but it is not the only source. Thrombin's only source is not the coagulation cascade. These are present in the body as well. So, naturally, so this is thrombin, which is 8 to 8A, it is formed by, held by thrombin. So, thrombin converts 8 to 8A. Now, 8A calcium and 9A converts 10 to 10A. Okay. Now, 10A, what is the role? 10A, what it does? This is the 10A along with 5A and calcium forms this prothrombinase complex. Okay. 10A along with calcium and 5A, activated factor 5A. Activated factor 5 comes from this. After activated 10A, this forms 5 to 5A. Factor 5 is converted to factor 5A. What is the source of factor 5? When you are asked what is the source of factor 5? What is the source of fibrinogen? What is the source of any clotting factor? The liver, right. But factor 5 and fibrinogen are two factors which are also stored in the platelets. Which granules? Alpha granules. So, dense granules, ADP, ATP, adenosine, any adenosine nucleotide and serotonin. Rest, whatever comes, it will mostly be this, if not certainly, there may be one or two factors, but mostly it will be alpha granules. So, 10 to 10A, 10A will convert 5 to 5A, and then a 10A, 5A and calcium together forms the prothrombinase complex, ACE, wherever we use the term ACE, AAC. So, that is breaking down another product. GI system, the GI system is being discussed, you know, ACE means it will break down. So, prothrombin will be now converted to thrombin, and thrombin is itself required in a previous step, but that is not after the formation. How will it induce a previous step? So, it is already in the body. So, thrombin not only required for 8 to 8A, but thrombin actually now fibrinogen to fibrin conversion is by thrombin, and fibrin polymerization of fibrin also thrombin has a role. So, fibrin fibers, in fibrin monomer to fibrin fibers, calcium has a role, and thrombin has a, calcium and thrombin both help to convert fibrin fibrin monomers to fibrin fibers means polymers. Again, cross linking of fibrin fibers, actually fibrin monomer to fibrin polymers by or fibers by calcium, and cross linking is maintained or it is brought about by thrombin. So, thrombin has a role in various steps like calcium. So, fibrin, that is also called thrombin. Activated fibrin stabilizing, thrombin gives rise to something called the activated, all these are obviously these are proteins in there. So, the activated fibrin stabilizing factor, and this will cause cross linking of fibrin fibers, and this will more or less in a way complete this secondary hemostasis. Okay. So, again these are the factors, this completes secondary hemostasis. Among the coagulation factors, here at the last, kininogen and kallikrein we have talked about. Okay, pre-kallikrein, kallikrein we have talked about. We have not talked about platelet phospholipids. What is the role of platelet phospholipids? Platelet phospholipids are released during platelet activation. Okay, platelet phospholipids from platelet. So, what is the role? Platelet phospholipids, calcium and that during in the intrinsic system, platelet, phospholipids, calcium, and together 9A, 8A, all these together along with platelet phospholipids forms a complex called the tenase complex, TNAC. Even if you, in a subjective type of question, if you don't mention these things at your level, not much discredit will be there. You just mention the steps. But again, I am saying these are days of MCQs. Sometimes you may get some words, so I try to mention some terminologies which are there. Actually, if you don't even write tenase in the subjective type of questions, it is okay. You don't know, that's acceptable at your level. But tenase, if you sometimes get in MCQs or get the term somewhere, tenase is talking of this coagulation pathway, intrinsic coagulation pathway. 9A, 8A calcium will convert 10 to 10A and along with platelet phospholipids. So, the role of platelet phospholipids is in that part. So, platelet phospholipids is also considered a coagulation factor, as mentioned. You knew of 13, so 16 or 17 will be there according, and that list I am giving from a very standard textbook of physiology. And a similar complex is there in the extrinsic pathway also, the tissue, similar to tenase, tissue factor 7A, activated 7A plus calcium, which is converting 10 to 10A, and then 10A and 5A comes from 5 to 5A is by primarily again by thrombin. So, thrombin is required in so many steps, calcium is required in so many steps in blue, thrombin, this green box, thrombin is in so many, 8 to 8A, then 5 to 5A, prothrombin to thrombin itself, formation of thrombin itself is catalyzed by thrombin, prothrombin to thrombin, and lastly thrombin fibrinogen to fibrin and cross linking of fibrin fibers. So, thrombin is required at so many steps, and this is very interesting that thrombin itself, this is like another, maybe we may call it like a positive feedback. Although thrombin is, again what I said, it is not the only coagulation pathway, is not the source of thrombin, but thrombin can be catalyze its own formation. So, 8 to 8A, 5 to 5A, thrombin itself, and fibrin, of course, fibrinogen to fibrin and cross linking of fibrin polymers. This complex is tenase, intrinsic pathway. This is a similar complex, it is not called tenase, it is tissue factor plus activated 7A and calcium, that is in the extrinsic pathway, and prothrombinase is complex of 10A, 5A and calcium. Platelet phospholipids, it is not written here, but include platelets for phospholipids in this tenase complex. I don't know, you can write this down because I don't know whether it is mentioned, this tenase thing is mentioned in the books you read or not, but and so that is why I told that it may not be required at your level, these terms, but if you come across MCQs you can tackle it. So, this is about the up to the coagulation pathway secondary hemostasis. So, tertiary hemostasis is, there is something called plasminogen. Plasminogen will be converted to plasmin and that will help to lyse fibrin. So, this plasmin lyses fibrin, that is what is at this level, this is sufficient, that plasmin helps to from plasminogen to plasmin, and there is something called the tissue plasminogen activator. After plasmin is formed, it helps to lyse the fibrin clots. That is what is about tertiary hemostasis. Okay, so in the next session we will discuss about the normal blood, this fluidity of maintenance of blood fluidity, normal, how this anticoagulant system which we may call, or this maintenance of blood fluidity, little about endothelium derived platelet factors, nitric oxide, prostacyclin, and protein C proteinase antithrombin, which we talked about, and very briefly, it is also mentioned in the CBME, discuss very briefly about the bleeding and clotting disorders. They have exemplified hemophilia and purpura, but we will talk, maybe we will exemplify one or two more, and we will talk it about in the next session. You can write it down now if you want. because this will give you all the names which are covered in all the names. Some you have to memorize. Why it is called, why factor 5 is called proaccelerating? These are just historical significance. It was seen accelerating. Factor 5 is that accelerating the final pathway, that is prothrombin to thrombin is what is essential, then thrombin, fibrin to fibrin. This is the in the essence of the clotting, this fibrin monomers will be. So, it is as if it is accelerating. So, pro-accelerating, pro-converting factor 7. So, it is in the which pathway? Extrinsic or intrinsic? Extrinsic pathway. So, as if pro-converting, it is helping in the, historically it was when they found it out, so many factors were not even discovered. They said that historically, they did not say history, they that time they thought that factor 7 is the one which is actually the essence of converting prothrombin to thrombin. So, they named it as pro-converting. So, now we have all these concepts, we all know all those things. So, the pro-converting name is not that significant, or it has not that relevance. It is not converting fibrinogen to fibrin, but that time when it was discovered, it was thought that this is itself, so it was named as pro-converting. I just can't recall the full form of SPCA right now. It is something I will tell it to you in the next session. So, SPCA, just write it down, SPCA has a full form as well. And why stable factor? So, whenever you see something, this is science is about asking questions, there should be some reason behind. Stable factor, it is not very heat stable, it is susceptible to various outside this physical environment, and so that is not, that is, it is stable, not susceptible. Factor 5 is susceptible, so that is labile factor. These are all named, names are historical importance, and or this physical characteristic, this goes by physical characteristic. Labile factor, factor 5 is labile, it is not very stable if beyond a certain temperature and all. So, that's why it is called labile factor. This has nothing to, these terms labile and stable has nothing to do with the coagulation pathway itself. This is outside the human body what will happen. So, factor 5 is not very stable, but factor, yes, so it is called labile. These are factor 5 is another example of a globulin protein. So, accelerator globulin. So, I told you why it is called accelerator, pro-accelerating, accelerator, and it is a type of globulin. So, accelerator globulin, all these names probably nobody will mention, we referring to factor 5 as accelerator globulin. It should not be done. Commonly factor 1 is fibrinogen, factor 2 is prothrombin, factor 3 is thromboplastin or called tissue factor, tissue thromboplastin or tissue factor. Factor 4 is calcium, write down the word, it is a very standard textbook, still they have not mentioned, you write down calcium ions, Ca2 plus, ionic form of calcium. Factor 5 is pro-accelerating, why I told you, labile factor, this has nothing to do with the coagulation pathway itself, but it is not very stable in terms of this physical characteristics. So, labile factor, accelerator globulin, factor 7, pro-converting, again at that time it was thought it is the one converting prothrombin to thrombin in a sense. So, that's why it was named. SPC I will come back and tell you. Stable factor, why I told you. 8 is anti-hemophilic, most commonly if it is has to be named, most commonly it will be named as anti-hemophilic factor A, not globulin, but it is a type of globulin. Factor 9, anti-hemophilic factor B, but the other names are Christmas factor, a commonly used name. Historical importance, factor 10 is Stuart-Prower, factor 11 is plasma thromboplastin, antecedent anti-hemophilic factor C. 12 is glass contact factor, why I told you, Hageman, again after the name of the individual in whom it was discovered, not the name of the scientist. Coagulation cascade, interesting thing, most factors, the names, the proper nouns which you find is after the name of the persons in whom they were discovered. Hageman was the name of that, so some Hageman. But glass contact factor, because if blood comes in contact with glass, it can be outside the body, intrinsic pathway can be activated, but the name intrinsic refers to within blood, extrinsic outside blood, tissue factor. Sorry. 12, 13 is fibrin stabilizing factor, but again Lucky and Lorand are names. So, fibrin stabilizing factor and along with thrombin forming fibrin cross fibrin, this cross link fibrin fibers leading to the completion of secondary hemostasis. HMWK required in the 12 to 12A, pre-kallikrein also same, and kallikrein and HMW together, HMW kininogen together hastens the conversion of 12 to activated 12, then it will carry on as 12A, it will convert 11 to 11A. Only if pre-kallikrein or kallikrein absent, what will happen? Blood clotting process will slow down, intrinsic pathway will slow down because 12 to 12A by kininogen it is slow. For it to gather a pace, it will require kallikrein and platelet phospholipids. I also mentioned why it is considered among the coagulation factors, formation of that tinase. So, tinase, have you written it down? So, tinase is factor, which one? 9A, 8A calcium and platelet phospholipids, and similar to tinase is tissue in the extrinsic one, the corresponding one is tissue factor plus 7A plus calcium, okay. And prothrombinase is 10A plus 5A plus calcium.